Hey everyone, my name is Raf and this is
Jules.
and for today's podcast we are going to talk about clinical simulation in action
Neurological assessment and clinical leadership.
and welcome everyone to our podcast. Today we'll be discussing an important nursing simulation that combines clinical leadership and neurological assessment in the care of a patient with acute ischemic stroke. We will demonstrate how nurses assess neurological status, coordinate the healthcare team, and communicate effectively during patient deterioration.
That's right. In emergency and critical care settings, nurses are often the first to recognize subtle neurological changes. Early assessment and prompt intervention can significantly improve the patient's outcomes. Our discussion today focused a 65-year-old male admitted to the ICU following an acute ischemic stroke.
So for our patient scenario, our patient is a 65-year-old male diagnosed with an acute ischemic stroke. During the morning assessment, the charge nurse notices that the patient is becoming increasingly difficult to arouse. His speech is incomprehensible and he withdraws only when painful stimuli are applied.
Because of these findings, neurological deterioration, the physician orders an immediate neurological assessment. As a nurse, our priority is to assess the patient's neurological status, maintain safety, and communicate our findings without delay.
So, for our clinical leadership begins with organizing the healthcare team. During emergencies, every team member should have a clear role.
For example, one nurse performs the neurological assessment. Another monitors the patient's vital signs and oxygen saturation. Another prepares emergency equipment and medications if needed. Then, a nursing assistant ensures the patient's environment is safe.
The delegation should always match each healthcare worker's competence, while the registered nurse maintain accountability for patient care.
Prioritization is equally important, following the ABC approach or the airway, breathing, and circulation approach. Airway, ensure the airway remains patent. Monitor respiratory effort and oxygen saturation. Administer oxygen as ordered by the physician. Then circulation, assess the blood pressure, heart rate, and establish IV access if necessary. Finally, perform the neurological assessment.
For today's podcast, we have the neurological assessment. For today's topic, our neurological assessment is Glasgow Coma Scale. The Glasgow Coma Scale, or GCS, evaluates three components: the eye opening, the verbal response, and the motor response.
So for the eye opening, the patient opened his eyes only to painful stimuli. So for the score of the eyes is 2.
So for the patient's speech is comprehensible. For the verbal response, the patient's score is 2.
So for the motor response, the patient withdraws from painful stimuli. So for the score for the motor response is 4.
Okay. So adding the scores, eye opening is 2, verbal response is 2, and motor response is 4. It's 8 out of 15.
A GCS, or the Glasgow Coma Scale of 8, indicates severe impairment of consciousness. This requires immediate notification of the physician because of the patient may require advanced airway management.
So for the management of airway and oxygen, since stroke patients with decreased consciousness are at high risk for aspirations, continuous airway assessment is essential.
So the nurse should maintain the head of the bed approximately 30 degrees unless contraindicated. Monitor oxygen saturation continuously. Administer supplemental oxygen as prescribed. Prepare suction equipment. Then ensure emergency airway equipment if available.
So for the cranial nerve observations, besides the Glasgow Coma scales, nurses also assess the cranial nerve to identify neurological deficits.
So for the cranial nerve 2, optic nerve. Observe whether pupils are equal and reactive to light. Check for visual response if the patient is able to participate.
So for cranial nerves 3, 4, and 6, oculomotor, trochlear, and abducens, assess pupil size, symmetry, eye movements, unequal pupils or abnormal eye deviation may indicate worsening of intracranial pressure.
So for cranial nerve 7, facial nerve, observe for facial drooping or asymmetry, especially when asking the patient to smile if able.
So for cranial nerve 9 and 10, glossopharyngeal and vagus, assess swallowing, ability, and gag reflex only if appropriate. Since stroke patients are